What is fibrocystic breast disease? Well, first of all, it's not really a disease. The term fibrocystic is really just a fancy medical way of saying breast tissue is a tissue that produces fluid. That's its job. What can happen is you can have hormonal changes that cause the tissue to turn on and create extra fluid retention in your breast tissue. Sometimes those fluids can coalesce into little bubbles in your breast tissue called cysts. That combination of having breast tissue that swells and shrinks, plus sometimes having fluid-filled cyst bubbles scattered in your breast tissue, usually in the upper outer portion of your breast tissue. All of that together is fibrocystic formation. So that's healthy breast tissue that is just swelling and shrinking with fluid shift changes, and together we call that fibrocystic disease, which makes it lumpy, which makes it tender. Every woman who has cycles will get fibrocystic breast changes to a degree. Some women, like acne, have a really hard time with it, with lots of painful tender lumps that get really swollen and big and small. Other women just, maybe they have a cyst that comes and goes, and otherwise they pretty much feel the same all the time. And if we looked closely with their breasts, we might find a couple little scattered cysts, but for the most part, can't really tell that they're there. If you're suffering with it, especially right before your period, there are some things that can make it better. We really love vitamin D, iodine, ground flaxseed, and if you want to take anti-inflammatory medicine before your period, that can be super helpful to reduce inflammation and pain.